Hello friends, today we are going to discuss about addictive behaviors, that is gaming and gambling. I am Dr. Suresh Badadmat, Professor of Psychiatry working at NIMHANS, Bangalore. In this video, I'll be discussing about addictive behaviors, that is gaming and gambling, prevalence, what is the comorbidity especially in these addictive behaviors, what are the assessment tools available, and treatment. This will be discussed keeping the current evidence available at this point of time. As you know, there are two important classificator systems. ICD-11, that is International Classification of Disease, 11th edition by World Health Organization, and also DSM-V, that is Diagnostic Statistical Manual of Mental Disorders 5 by the American Psychiatric Association. Both of them clearly recognize this gambling and gaming as a behavioral disorder, that is addictive behavioral disorders. As per ICD-11 Chapter 6, which discusses about the mental, behavioral or neurodevelopmental disorders, in that there is a chapter which discusses about disorders due to substance use or addictive behaviors. As you know, there are two important addictions. One is psychoactive substance, another one is addictive behaviors. Let's look into that. If you look at the disorders due to substance use is a physical substance which is consumed, such as alcohol, cannabis, synthetic cannabinoids, opioids, sedatives, hypnotics, cocaine, stimulants, synthetic cannabinoids. There are 14 different types of substance have been recognized which causes addiction. But however, the importance is in this video I'll be discussing about addictive behaviors, that is gambling disorder and gaming disorders. Along with this, there are two more have been recognized under ICD-11. That is, other specified disorders due to addictive behaviors or disorders due to addictive behaviors unspecified. So these are the four categories which have been discussed in ICD-11 under addictive behaviors. Let's look into this addictive behaviors. In that, I'll be discussing first about the gambling disorder and later I'll be discussing about the gaming disorder. Let's discuss about the gambling disorders. Gambling disorder is defined as a persistent and recurrent problematic gambling behavior leading to clinically significant impairment or distress. The wordings are very clear. It should be persistent. It should be recurrent problematic gambling behavior leading to clinically significant impairment or distress. Individuals with gambling disorder often go unrecognized. That means they'll never be unrecognized and they'll never be treated. That's a biggest challenge at this point of time. Even if they go to the hospital, even for a psychiatric hospital, this gaming, gambling are very difficult to identify. The reason being is the gaming disorder or the gambling disorder, they are socially accepted. In some cultural setting, it is considered as a very well-known during festival it is used. There is no stigma attached to this. The culture plays an important role. The legal restriction, if it is there, excellent. But if there is no legal restriction and regulation, it will be used as a part of an occupation, making money, and various things. Hence, the gambling becomes very difficult to recognize and also to treat. It is not also, and at the same time, please do understand, it is very difficult to treat. It is also considered as a chronic, relapsing, remitting disorder. And however, during the COVID lockdown, this gambling opened into a virtual network. That means online gambling becomes very rampant, which became access to children and adolescents, which is a very serious threat at this point of time, my dear friends. Let's look into the gambling disorder as ICD-11. What does it takes in to make a diagnosis? In ICD-11, they clearly talk about first and the foremost is persistent or recurrent gambling behavior. That should be the first. And there should be impaired control. They are unable to control the number of times they play, the number of hours they play. They think they can control that, but they are unable to control the gambling behavior. Second one important is the gambling takes precedence over all other activities. It can be occupation, it can be family issues, it can be job, it can be education. That means all their activities Even the pleasurable activity revolves around gambling. And this gambling continues to exist in spite of negative consequences. That means they have lost huge amount of money. There is a family problem. There is educational problem. They have lost properties, but still the gambling continue to exist. This should be continuous or it can be episodic. This should not be part of any other illnesses like mania. That is very essential. But this gambling disorder should exist with impairment in personal life, family life, social life, educational life, and occupational, of course. However, ICD-11 gives a core specifier. This gambling can be predominantly online, that means playing online, or else it can be in person, that means they go to casino and play, or else it can combination of both also can be there. The additional features to consider it as gambling is there has been a number of unsuccessful efforts to control gambling, but they are unable to do. There is craving, that means irresistible urge to play. Gambling is one essential. There is a negative affective state if they don't play. That means if they want to play and they are unable to go and play, there is a irritable mood, feeling of boredom continues to exist. And this gambling is associated with various comorbid mental disorders such as depression, dysthymia, personality disorder, substance use, and suicide. This is a very commonest feature we have been seeing, and many people have lost their life because of gambling. There should be a substantial disruption in biological function, social function, and occupational function, which we had discussed earlier. There is an increased amount of spending money on gambling, that is chasing the loss. That means today they lost 1 lakh rupees. Tomorrow he would like to recover this 1 lakh and he will bet for 2 lakhs. After 3 days, he wants to get 3 lakhs back. He will bet for 4 lakhs. So that means there is a chasing to get the loss back. So in this chasing, they will lose huge amount of money. Invariably, they will take loan. That leads to further problematic behavior. Further, they will be engaged in deceitful behavior. That means they will tell lie to the family members, telling that they are not playing gambling. They will take money for something else and they will spend it on gambling. They will say, I will pay the child's exam fees, and they will spend on gambling. And they will take loan from various people by telling lie. And they go and gamble. That means deceitful behavior is one of the classical symptoms of gambling. Then gambling behavior can also follow a continuous or episodic pattern. The intensity of gambling behavior often fluctuates in relation to stress, depression, and substance use. That means whenever there is a stress, the gambling increases. Whenever they feel boredom, it increases. And with substance use, it increases, worsens. Gambling typically has its onset in the adolescent or young adult. Early onset is associated with higher levels of impulsivity. That means as a kid, if they are gambling, that means their impulsivity is very high. Now let's look into the DSM-V, that is American Psychiatric Association. What is their criteria to diagnose as gambling disorder? There should be again a persistent, recurrent, problematic gambling should be the first, and there should be at least 4 or more symptoms in the below 9 symptoms which have been mentioned over a period of 12 months. First is tolerance. That means they need to gamble more to get the same high. Irresistible impulse to play or urge to play, that is craving. Unable to control or cut back the gambling, that means they are unable to stop it. They are often preoccupied with gambling, planning for gambling. Often gambles when feel distressed, that means they are depressed or boredom, they go for gambling. Chasing one's own loss is one of the characteristics of gambling. They lie to conceal the loss or involvement of gambling, or their gambling. They will tell lie to the family members and loved ones. There should be occupational, educational, relationship, and career loss or dysfunction, and they rely on others to provide money for gambling. They will tell lie to take this money. They have a desperate requirement for finance. They take loan. They will fight with the people who had given loan, and relationship goes in a wrong way. There is a core specifier under DSM-V. Mild means 4 to 5 criteria, moderate means 6 to 7 criteria, severe means 8 to 9 criteria. It can be episodic, it can be continuous. In early remission, that means 3 months to 12 months they have not played. In sustained remission means more than 12 months. Let's look into the prevalence of gambling. As per the US study, the gambling as an addiction is there in 0.4 to 1.1% in adults. However, the problematic gamblers, they are episodic, which is around 1 to 2%. However, various systematic reviews have said across the world, the gambling varies from 0.2% to 5.3%. This variation is because depending upon the diagnosis is used, depending upon what type of population is studied, how the sampling method, what is the assessment tool used, and where this study was done. On that basis, this gambling varies from 0.2 to 5%. 5% is a huge population. Let's look into the comorbidity. That means gambling is associated with various other psychiatric illness. The commonest is alcohol use disorders, tobacco, and sometimes drugs. Further, the commonest is depression and dysthymia, generalized anxiety disorder, personality disorder, suicide, and highly impulsive disorder is seen. That is, impulsivity is seen. Further, family discord is very common in gambling. Let's look into the etiology. Why the gambling occurs in few people. There are various theories. Hypothesis has been put forward. First one is neurocognitive. That means the person who is gambling has high impulsivity. That means decreased activation in the ventrolateral prefrontal cortex, which has been noted in various neuroimaging studies. Further, there are various neurotransmitter hypotheses like dopaminergic, serotonergic, and noradrenergic and opioidergic were also considered as the reason for this addiction. Neuroimaging research suggests that the dopaminergic mesolimbic pathway from the ventral tegmental area to the nucleus accumbens have been involved in the pathological gambling, which is similar to any other substance use like alcohol dependence or drug dependence. That means the pathway remains the same, whether it is addiction for substance or addictive behaviors, that is gambling. Further, various neurocircuits have been implicated, such as corticostriatal limbic structures have been implicated. Further, there are various environmental factors, such as exposure to gambling in childhood, adverse psychosocial influence on the child, traumatic experience on the child, broken families have been indicated that they are high risk for developing gambling. However, the most commonest accepted model is integrative model, that is biopsychosocial model, and pathway models have been implicated. What is this integrative model? It is cognitive, behavioral, and stress diathesis model has been given. That is the framework under which the gambling has been understood, and also the therapy is focused from this model. Here, early gambling experience, exposure to gambling from the parents, adverse psychosocial experiences in the childhood, trauma in the childhood, behavioral conditioned with regard to gambling, and further emotional vulnerability and high impulse control disorders have been considered as the reason for development of gambling disorder. Let's understand the management of gambling. First and the foremost is screening and assessment. The reason being is whether it is just a culturally accepted gambling, or else it is a pathological gambling, or else is it a addictive gambling or problematic gambling. There are various instruments are there. The commonly used 3 instruments is South Oak Gambling Screening Instrument and Canadian Problem Gambling Index, and positive response to any one item indicated likely problem of pathological gambling and the need for further assessment has been considered. That is National Opinion Research Center Screening for Gambling Problems. That is, there are 3 items that is called as NODS clip. Here in NODS clip, it focuses on 3 important screening items. Those are: have you ever tried to stop or cut down or control your gambling? That is C. Have you ever lied to family members or friends or others how much you gamble and how much money you have lost on gambling? Are you lying? That is C is for cutting down, Li for lying, and P, the period lasting for 2 weeks or longer when you spent a lot of time thinking about gambling experience or planning to gamble. So if there are three questions, if it is yes, that means you have to go for the complete version of Nod Clips. That means this questionnaire revolves around three important things: loss of control, lying, and preoccupation. Positive response to any one of the items indicates that there is a pathological gambling and we need to do a complete thorough assessment, including comorbid assessment. Now, let's understand about the problem gambling severity index. In this index or a screening instrument, it is a 9-item scoring where 9 items are scored never as 0, sometimes 1, most of the time 2, almost always 3. Minimum score is 0, maximum is 27. The more the score is severe is the gambling. Now let's look into this 9 items. Thinking about the past 12 months, have you bet more than you could really afford to lose? That means, are you betting more than what you are earning or that you can afford? Still thinking about the past 12 months, have you need to gamble large amount of money to get the same feeling of excitement? That is tolerance. When you gambled, did you go back another day to try and win back the lost money? That is chasing the loss. Have you ever borrowed money or sold anything to get money to gamble? Have you left that you might have a problem with gambling? That means you're thinking that I should have left. Has gambling caused you any health problems, including stress or anxiety? Have people criticized your betting or told you that you have gambling problem, regardless of whether or not, though it is true or false? Are you criticizing? They are criticizing you. Has you gambling caused any financial loss? And also at the home front, have you ever felt guilty the way you are gambling, or what happens when you gamble? So these are the 9 questions which have been asked, and 0 to 3 has been the considered. So 0 is if the total score is 0, no non-problem of gambling. 1 to 2 is a low level. If it is 3 to 7, moderate level of problem is there. Anything above 8 has a severe gambling problem. Think about it. 9 items, maximum score is 3, 9 3s are 27. If it is 8 itself is considered as a severe, if the more and more, that means it is very difficult to treat. What are the treatment? The treatment, there are 2 important: medications and psychosocial treatment. In medications, there are various systematic reviews have been done, meta-analysis have been done, but unfortunately, systematic studies are very, very few. That too, RCTs are very few. And there are various medicines have been tried either as a case study or else as an open label trial. The commonest is naltrexone has been used in the dosage of 50 to 150 mg per day. Other medicines which have been tried is nalmefene, fluoxamine, paroxetine, sertraline, bupropion, olanzapine. However, the response rate appears to be varying. The more systematic study is required. However, the current understanding is naltrexone is the drug of choice at this point of time. There are some studies which indicates that the naltrexone decreases the high involved with gambling. However, we need to have very good RCTs available for this gambling disorder. The choice of medications which have been mentioned based upon various other indications. What is the hypothesis the doctor believes in with regard to gambling? The presence of comorbidity. Imagine there is a depression, dysthymia. Invariably, selective serotonin reuptake inhibitors will be chosen. It may be bupropion, it may be sertraline or escitalopram. If there is anxiety, again SSRI will be chosen. Other substance use is there, alcohol is there, then the other medications will take precedence. If there is a mood disorders are there, valproate will be considered. If impulsivity and craving is there, Of course, in impulsivity, SSRI is the best. And for craving, of course, naltrexone or SSRI will be considered. To date, till date, no pharmacological therapy as a indication which has been approved by FDA has been available at this point of time. Although placebo-controlled trials suggest that some medication such as opioid receptor antagonistic may be helpful at this point of time, my dear friends. That means to say this is the first line, second line, third line, it is not available. You need to focus on the comorbidity and the plan of management has to be considered. That is the psychopharmacological management of gambling. Let's understand from therapy, that is psychotherapy. There are various therapies has been considered, but cognitive behavioral therapy has been considered as one of the best at this point of time. Family therapy, that is community reinforcement and family therapy model, that is craft model, has been considered, and self-help, gamblers anonymous self-help groups have been considered. That means we have two important. One is self-help groups where gamblers go there, discuss about their problem and they want to quit. This is highly accepted by the gamblers and it is well accepted, no stigma, discrimination involved. If you go to professionals, cognitive behavioral therapy is there, family therapy is there, craft model is available. But here, there will be stigma, discrimination, they have to pay for their therapy. Further, considering that gambling is a problem to me, that insight may or may not be there, and even if it is there, they may shy away for taking treatment. There was a review on psychological treatment, a study done by Rash and Petrie. There are various buffet of psychosocial treatments are available, from workbook, peer support group, anonymous self-help group, brief intervention, 3 to 4 sessions, cognitive behavioral methods, cognitive behavioral therapy, blended treatments are available, both in-person cognitive behavioral therapy, online cognitive behavioral therapy have been tried. But currently, although there are various therapies are available, systematic studies are very few. Whatever studies are available, it indicates cognitive behavioral therapy is the best. But Gambler Anonymous is well accepted and the treatment retention is very high there. Whereas in cognitive behavioral therapy and other, the treatment retentions are very few. We need to do a systematic studies at this point of time. But at this point of time, what is the evidence suggest? The evidence suggests both combination of pharmacotherapy and psychosocial treatment, including Gambler Anonymous. If you combine all of them, there is high possibility the person will quit gambling. That means you need to have self-help group, professional help, and medication. That is the best available treatment at this point of time, my dear friends. Further, we need to have policy and also preventions which should be started parallelly so that this gambling should not become a public health issue in our society. There are some countries which have taken it very seriously. They have their own policies. They have their own laws to regulate this gambling. Hence, we need to come up with a policy and law with regard to gambling. Legal regulation should be placed with regard to gambling. It may be online or else it may be in person. Advertisement of gambling, especially in India, is increasing very rampantly, including the biggest celebrities or so-called role models are using this gambling, online gambling, for advertisement, for money. They do not know what is the impact on children, adolescents, and the families of the gamblers. Hence, there should be an awareness program, ill effect of gambling, especially in children and adolescents, in high schools, colleges. That should be started at the earliest. To conclude, my dear friends, with regard to gambling, it is a disorder which is persistent, recurrent, difficult to identify, difficult to treat, poor insight, chronic relapsing disorder. Hence, it should be considered as a public health issue and there need to be a policies, regulation in place. A systematic studies need to be conducted. That is what the current literature review talks about gambling, my dear friends. Now let's move into gaming disorder. The gaming disorder, both internet gaming and in-person gaming. As I mentioned earlier, under ICD-11, disorders due to addictive behavior, after gambling, the gaming disorder. Gaming disorder is a mental health condition that involves compulsive playing of video games or else in-person gaming that significantly interferes with their ability to function in important areas like schooling, education, academics, personal life over an extended period of time. Online gaming at this point of time is a $100 billion industry and that continues to innovate and expand globally. As I mentioned, this online gaming advertisement has increased phenomenally across the country. Unrestricted online gaming is highly very absorptive. It is easily accessible. Children and adolescents are falling prey to this. They start with the animations gaming. Even the age of 3 years, 5-year-old children are gaming online. Highly anonymous. It is available 24/7. At the same time, free gamings are available. Paid gaming is available. Virtual reality based gaming is there. Gaming community is there. And also gaming world where the people will take different avatars, interact with the other avatars who are there online, and they collectively play the game. And this is becoming very highly addictive, highly immersive in nature, at the same time, highly destructive. And this can become addictive in vulnerable population. But however, in moderation usage of gaming has found to be useful in certain studies. That means normal usage. Here it improves their cognitive performance, increases attention and concentration, and some of the games have been used for cognitive restructuring, especially in dementia. Further, if it is used in normal or moderation, their self-esteem will improve, their interaction online increases, social skill improves, visuomotor skill improves, and some of the educational games have been found to be useful in improving the academics. That means making the education interesting. That means it is a double-edged sword. But however, we need to understand gaming disorder in certain people, they can become addicted. That means pathological gaming, you can call it as, or addictive gaming disorder. There has been a prevalence study has been done. A meta-analysis of 53 studies have been done, and this was study published in 2020. Stevens and his colleagues have done that. If you look at the literature review and the systematic analysis, the meta-analysis indicated 3% have addiction of gaming disorder. It is across the world. The numbers are very huge, my dear friends. And in children and adolescents, it is 2%. Think about 18 years and below, 2% of them are addicted to gaming disorder, my dear friends. Let's look into the diagnostic criteria for gaming disorder as per ICD-11. First and the foremost, it should be persistent, a pattern of gaming behavior, impaired control, that means they are unable to control the amount of time spent on gaming, salience, their priority for gaming takes over across all other activities. It can be pleasurable activity, studies, going outside with friends. All those will be neglected and gaming takes the precedence. Continuation of gaming in spite of their ill effect. That means they have lost the exams, they are failing, families are fighting with them, but still they continue to game. Pattern of use of gaming may be episodic or continuous. There should be significant distress or impairment with regard to academics, especially in children. Occupational impairment or social or family impairment should be there. Specifier as per ICD-11 is it can be online, it can be offline, that is in person, or it may be combination of both. Additional clinical features of gaming is craving should be there, that is irresistible for gaming. Negative affective state or withdrawal symptoms if they don't game. Comorbid mental conditions such as depression, anxiety disorder, personality disorder, substance use disorder, and various other disorders have been well known. And high frequency and long duration of gaming behavior is well known, and it can associated with negative affective state. There should be substantial disruption in biological, social, and occupational functioning. However, this gaming disorder can be associated with peer groups. That means there may be a community of friends who are online. They may influence the person to play. That does not negate the diagnosis of gaming disorder, my dear friends. Now let's understand gaming disorder from DSM-5. In DSM-5, out of 9, at least 5 symptoms should be there. They are preoccupation for gaming, withdrawal if they don't game, such as feeling restless, irritated, angry, anxious, sad mood, tolerance for the gaming. They need to spend more time, highly novelty game, risky game they want to play, unsuccessful attempts to control the gaming, loss of other interest, that is salience, continued excessive use despite psychosocial problems, that means their harmful use is there, deceiving regarding online gaming, that means they will say lie to game, escape is used as a gaming so that they are coming out of the boredom, feeling neglected, they are using gaming as an escape mechanism, and in spite of having negative consequences, they continue to game. But however, there should be a significant impairment and distress in their life. Let's understand the impact of gaming addiction. If you look at the impact, the gaming addiction has directly involved in cognitive skills, cognitive deficits over a period of time. It leads to various other problems. This gaming addiction is also involved with self-esteem. Poor the self-esteem, they would like to take various avatar and they want to interact as avatar. They want to fulfill their wishes through that avatar and depict in a different manner. That self-esteem plays a very essential role. Social interaction decreases in real life, and virtual life it may become addictive. This gaming is used as an escapism from the real life to be in the virtual life. Mood swings, especially boredom, feeling of depressed, increases the addictiveness, and the self-control mechanism is lost with regard to gaming. That we need to understand. This gaming also is involved with physical illness such as obesity, eye problem, neck pain, hand problem, thumbs, carpal tunnel syndrome. Various other problems are well known, established under gaming disorder. Comorbid psychiatric conditions like alcohol use, tobacco use, drug abuse, depression, dysthymia, anxiety disorder, panic disorder, personality disorders are well known. Although, especially in gaming, there is no exogenous chemicals are involved. That means like alcohol, cocaine, morphine, opioid, cannabis, no such things are involved. But this is a non-substance dependence. That means there is no substance involved, but this causes dependence similar to alcohol. So various neuroimaging studies have clearly indicated that the areas in the brain involved in alcohol dependence or morphine dependence, same areas are involved in gaming. That means whether you take drugs or whether you play game addicted to it, the brain damage is similar. There was a study done by Meng and his colleagues. They conducted a meta-analysis of functional imaging studies. High quality imaging studies were included. There were 10 studies. The conclusion of this study said that the regions involved in the brain is medial frontal gyrus, left cingulate gyrus, left medial temporal gyrus, and fusiform gyrus. These are seen in gaming addicted people compared to control groups, and these are all similar to drug addicts. The functional imaging study done in the drug addicts. Let's look into the assessment tools. There was a clinical psychological review journal published a screening and assessment tools for gaming disorder. This was an important article I would like to mention. This compared 32 instruments or screening instruments by King and his colleagues. They reviewed all these 32 instruments. Few of the scales are mentioned here, such as addiction engagement questionnaire, video game dependency scale, game addiction identification test, game addiction scale 7 items, 21 items, internet gaming disorder 20 test. So there are various scales are available. These are up to 32 are there. This is how, if you look at on the item wise, DSM-5, what are the diagnostic criteria, ICD-11, and in the top you can see the instruments are mentioned. And if you look at this, these are those important instruments which cover both the DSM-5 and ICD-11, and these are the instruments which have been accepted across the world. However, the study concluded by telling that there is an overproduction of these scales. Hence, they cannot be compared across the world. Hence, uncertainty among the researcher continues to exist. Despite the abundance of various scales, 32 scales, imagine, my dear friends, these are the important scales which have been found to be psychometrically very good. They are gaming addiction scale 7, internet gaming disorder scale 9, internet gaming disorder 10 item scale, and internet gaming disorder 9 item scale. So these have been found to be useful, my dear friends. And if you are planning studies, use these scales. For the field to prosper in gaming disorder, we need to come up with a single instrument similar to WHO's audit or assist. They will help us to do more research in the gaming disorder. Not only that, it will also able to pinpoint the neurobiology of gaming so that we can address this menace before it becomes a severe problem in our society. Let's look into the treatment of gaming disorder. There was a review published in 2020 in Expert Review of Neurotherapeutics. Treatment of internet gaming disorder by systematic review was done. In this, they considered 22 different studies. They evaluated 7 medications, 8 cognitive behavioral therapy studies, and 7 non-medication other approaches were considered. This study concluded that research on medication for internet gaming disorder is inconclusive. Somewhere bupropion has been considered to be a drug which have one or couple of studies are available. Initial stages of evaluation says bupropion can be chosen. However, there is no systematic RCT available, my dear friends. Some studies with regard to CBT, cognitive behavioral therapy has been considered to be a gold standard, but however, again, systematic studies are not available at this point of time. But CBT can be used. Additional research is required in this area to prove that the psychosocial treatment can be used in gaming disorder at this point of time. Since children and adolescents, 2% is there. So gaming disorder, CBT plays a crucial role. In general, there is a weak design with regard to medication, with regard to psychosocial treatment. Hence, it is very difficult to come up with a good treatment aspects at this point of time, my dear friends. But CBT, at the same time, we need to use medications, and the presence of comorbidity such as depression, presence of other substance use, anxiety disorders will dictate the pharmacotherapy, my dear friends. But however, there has been a criticism with regard to involving only the gaming disorder and gambling. There are various other problems with regard to internet. They are internet addiction, pornography addiction, social media addiction, online shopping have not been included at this point of time. But however, there is a scope to be included either in ICD-11 and DSM-5, either in the unspecified version, it can be added there. To conclude, my dear friends, ICD-11 proposes this behavioral addiction as one of the important. Gambling and gaming has been included both in DSM-5 and ICD-11. It includes both offline and online, but the problems are increasing, especially with regard to online, because it is easily accessible. Children and adolescents are exposed to it. Anonymous, available 24/7. You can interact with any person across the globe, and there is a community of gaming available, socially accepted among the peers, especially in children and adolescents. It is highly addictive. At the same time, various tasks are given. Children and adolescents are falling prey to this gaming as well as gambling. There is an urgent need to do a systematic study. For that, we have to come up with a very good scale. It has to be 1 or 2 scales, and WHO has to take a lead in this to come up with, so that we will be able to have a single instrument which can be translated into various languages like audit, and that can be used to come up with a similar research across the world. comorbidity appears to be high both in gambling and gaming disorder, and at this point of time, this comorbidity dictates the treatment at this point of time, both with regard to pharmacotherapy and psychosocial treatment. With regard to gambling, anonymous group, self-help groups have been found to be very useful at this point of time, but combination of treatment have to be considered at this point of time because the lack of evidence prevails at this point of time, my dear friends. So this is addictive behaviors, my dear friends. So please do consider subscribing and sharing this video. Thank you very much for your valuable time. Stay safe.